While the benefits of care programs are expansive, they ultimately hinge on the ability of care managers to successfully engage with their patients, as well as motivate them to make the changes that will positively impact their health for the long run. In this video, we're going to dive deeper into motivational interviewing and how it can benefit your care managers in successfully engaging their patients, but also benefit the patients to make the changes that you want to see. Hi, my name is Catherine Anderton, and I am the Clinical Product Analyst here at ThoroughCare. Given the elective nature of chronic care management programs and other care coordination programs, it can be really challenging for staff to engage patients. They have to want to do it, so there are a few strategies that we can implement to increase that engagement, which is also ultimately going to increase the success of patients in their time in these care management programs. A great way to accomplish this and engage patients is to utilize strategies from motivational interviewing. Motivational interviewing has 3 distinct qualities that can help set you up for success. The first is that you can gently guide the conversation while balancing giving advice while also listening to the patient. The second is empowering change in patients by using the identified patient-specific motivating factors. Lastly, you want to use respect and curiosity to advance positive patient changes, while also leaving room for a patient to be autonomous in their choices. It is important for care managers to keep these 3 things in mind for each of their outreaches, each of their engagements, every time they're talking with the patient. The process of motivational interviewing can be broken up into 4 parts: engage, focus, evoke, and plan, while also understanding that at any point in time, the process for change is not always linear, so you can hop between each item. Let's dive deeper into each of those categories. Regardless of how great a care manager may be, if they aren't able to successfully engage that patient and get the information they need from the patient, the quality of care will be limited. So it's really important for care managers to engage patients, and that can be done by asking open-ended questions, demonstrating active listening so that they know that you are listening to what they have to say and you care. During this time while you're engaging the patient, it's really helpful to be building that rapport with the patient, and then that's building the trust with the patient so that you can have a long-lasting relationship where change can occur. The care manager should continue to monitor a patient's engagement throughout the entire course of the relationship, recognizing that it can shift. Care managers who successfully engage their patients can create a more comfortable environment for their patients to promote that change. Once you've engaged with the patient, it's important to focus. Having a new diagnosis of a chronic condition, or even 2 or 3 chronic conditions, can be really overwhelming for patients. It's really daunting, and oftentimes there's a huge risk of information overload. So it's important to give that patient some focus. You want to ask the right questions to understand exactly what their limiting factors are and help focus on goals that they can achieve and give them that sense of direction and sense of purpose in managing their health. Once you've identified the patient's focus on their goal, this is going to increase patients' autonomy. It will empower them to manage their health more successfully. You're also using patient-specific motivating factors, which are going to increase the chance of positive change as well. In addition to focusing on the goals that are important to the patient, there are also goals that the care manager has probably identified the patient needs to work on as well. Part of the focusing is also ensuring that you've identified that goal and you continue to maintain that focus throughout all of the conversations. It helps keep you and the patient on track for managing their health successfully. Having measurable goals that have a time frame is also really helpful to garner that focus and provide that patient with the direction on where they need to be while monitoring progress along the way. Now that we have engaged our patient and also focused on their specific health goals, it's important to find what motivates that patient for change. This is the evoking process of motivational interviewing. You want to evoke that emotional response that will lead to a positive impact. So that's asking the questions of, why is this goal important to you? How does it look like when you're successfully managing your chronic conditions? If you don't, what are you concerned might happen? You can use this information to help motivate the patient along the way to stay on track. Oftentimes when patients are receiving education from healthcare professionals, it's people talking at them, dumping information on them and telling them what to do. But research shows that this is not the best way to invoke change in patient population or any population. You need to bring in not just the facts of the scenario, but bring that emotional response to keep the patient empowered and inspired to manage their health. Now that we have engaged the patient, focused on the goal, and are evoking change, we need a plan. So the last step is planning. Here is where you have everything that the patient wants to have happen, the goals you've all agreed on, and now we're going to set some interventions to help us get to where we need to be. It's important too that the interventions are not all on the patient and they're not all on the care manager. It's a collaborative process, and this can help the patient feel like they're not isolated or alone in managing their health. They recognize that their care managers are there as support, and we're working alongside them to get them to where they need to be. Given the clear overlap between care coordination and motivational interviewing, it's no wonder that employing motivational interviewing technique can lead to greater success in patient outcomes. I encourage you all to look more into motivational interviewing and practicing this, and I look forward to hearing how it impacts your patients positively. If you wish to learn any more about motivational interviewing or care coordination solutions, feel free to click the link below, and also feel free to like and subscribe to see more content like this.